Good afternoon, everyone. This is Tammy Castrini from Insurance Advisors Direct, and I'm here with Jack Thedawa from HAP CareSource, and he is going to be talking to us about their 2025 ACA product launch this year. And as always, we have everyone on mute, but if you have any questions, please be sure to put them in the question and answer, and I will monitor it throughout the presentation. And no further ado, Jack, I am going to go ahead and let you get started.
Great, thank you much. Thank you everyone for being here. Again, Jack Thedawa. I'm new here at HAP, so I'm very excited to be here and helping you all out with your marketplace products through HAP this year, new product to the marketplace. So I'm going to get right into, the health insurance marketplace. You can see that new logo, the HAP CareSource logo. So I like to explain that just briefly. So CareSource and HAP have had a relationship with the Medicaid products in Michigan in a few counties for, I believe, a couple of years now. Maybe it's just a year, but we are using that relationship to bring marketplace products to the state of Michigan this year. So CareSource has been offering marketplace products in other states throughout the country for quite a while now, and they're very, very good at it. So it's a great relationship that we're building here in Michigan. So CareSource is going to be, all these products are going to be really on CareSource paper. They are going to be handling a lot of the back end administrative, contracting, commissions, things of that nature. Where HAP is going to be handling a lot of the sales aspect and the agent facing aspect. So that's where I come into play, as I will be the rep for you all when looking at these products. So our service area, and I hear there were a few of you on maybe yesterday's webinar. The heat map presentation that CareSource did had a lot of good information. I'm going to get a little more product specific today. But if you were on that presentation, you saw our service area. We're going to be in 6 counties to open up 2025. Wayne, Oakland, Macomb, then Lapeer, Genesee, and Shiawassee. It was great to hear on the webinar yesterday that expansion is a pretty high priority going into the next couple of years of this product. So look out for that in the years to come. But for this year, 2025, we'll be in these 6 counties. So that is going to take us into our bronze plan. And just to really start out, to be upfront with the bronze plan, the HAP CareSource bronze is probably not going to be a competitive product for us. If someone's going to be looking for a bronze plan, they're probably going to look elsewhere. These plans were really brought to the marketplace to provide value. Because we are not going to be the cheapest. We're not going to hit the Ambetter pricing on any of these plans. But you'll see in these next few slides when we get into the silver and gold plans how much value there can be, and really I believe how easy of a sell these plans can be. But as far as the bronze, this is a very standard bronze plan. $7,500 deductible, $9,200 max out of pocket, with 50% co-insurance. The primary care and specialist visits, $50 and $100 copay, and then urgent care $75 copays. The $25 generic prescriptions. That's tier 1. I believe on the bronze plan, tier 1 and 2 are all copay instead of deductible first. I believe it's once you hit tier 3 where you go where the deductible is involved. Okay, so these are. I'm much more excited to talk about the silver plans here. You see we have some options. And 3 of these silver plans have their own slides that go a little bit more in depth. So that would be the high deductible health plan preventative, the diabetes silver, and the Healthy Heart Silver. There's going to be another slide that's going to go a lot more in depth with each of these plans. The low premium silver and just the standard silver here, both very good plans. And again, I hope you were on that. Some of you were on that webinar yesterday. You can see they're pretty competitively priced. Again, we're not going to be the lowest price, but in terms of value and coverage, we're going to be very, very competitive. And I guess before I started talking about the plans, I should have touched on the network. So I'm going to do that quickly here. We are going to be using the HAP commercial HMO network. And there's, a great tool online for that, both through HAP and through CareSource on both of their websites. But that's a network that's been around a long time, pretty expansive network, and is also a great value add to these plans. But for the two silver plans here that do not get their own slides, again, that's the low premium silver and the silver 5,000. You can see the deductibles there, 6,000 and 5,000. The out-of-pockets, 9,000 and 8,000, and then 40% co-insurance on both those plans. Again, pretty standard stuff. The emergency room visits is, and I'm going to jump down there because of the little asterisk, is after deductible. So that's what that little asterisk means. So in that low premium silver, if you hit that $6,000 deductible and have an emergency room visit, you're not at that 40% co-insurance for that emergency room visit. You would just have that $500 copay. And you can see that as well in the diabetes silver, where it's just that flat copay instead of deductible co-insurance, or I'm sorry, if you've hit your deductible, just that flat copay instead of the co-insurance amount. And again, if there are questions, I don't think I can see those, but if someone can stop me, that'd be great.
No questions yet, but
Okay.
you should be able to see them, but I'm monitoring it.
Okay, very good, thank you. Okay, and where was I? The prescriptions again. It varies from plan to plan, whether, before you've hit your deductible, if you'll have the flat copay or if those prescriptions are subject to that deductible. But again, most of these plans you can get up to tier 3 with just the copay before you hit that deductible. And then and again, there's a couple plans we haven't touched on here. Again, that's because they get their own slides. So I'll kind of come back and forth for those 3 plans. The gold plans, very competitive as far as gold plans go. Again, they offer a lot of value. I've used that word a few times already, and I will probably be continuing to use the word value. The diabetes and healthy heart, again, there's going to be some more information on why there's so much value in those plans in the next slide here. But $1,500 deductible, maximum out of pocket of $7,800 on the standard, the gold $1,500 here, 25% co-insurance. The primary care and specialist visits, $30 and $60, $45 for the urgent care, 25% co-insurance after you hit that deductible for the emergency room. And then the prescriptions, again, pretty competitive on the co-payments there. So without further ado, let's get into these plans that I'm really quite excited about. The diabetes, silver, and gold. So important, anybody can be on these plans, even though they're called the diabetes, silver, and gold. You don't have to be, a diabetic to be on the plans. But these plans are really, there to provide a lot of value for those individuals. So a lot of $0 drugs, screenings and tests, and $0 DME for a lot of those diabetes related things. The testings, all $0 copays, A1C, eye screenings, kidney disease screenings, routine diabetic foot care, diabetes self-management education, and nutritional counseling, all $0 copays. $0 drugs, you can see a lot of the most common ones here as far as the regular insulins, fast acting insulins, long acting, and then generic oral drugs, even a lot of the brand name drugs, which there are prior authorizations needed for, the Jardiance, Farxiga, the GLP-1 drugs, but even those would be $0 copays on this diabetic silver and gold, as long as they're being used for the diabetic needs, not covered for weight loss or anything like that. But you can see where this plan is really there to provide a lot of value for someone that needs coverage and has diabetes that they deal with. The DME, continuous glucose monitors and test strips. We have our certain vendors that give us the $0 copay there. And then there is a adult vision rider available. And there's another slide on that here soon. But that is what we have for the diabetes silver and gold. On to the healthy heart silver and gold. Again, just like the diabetes, you don't have to have any heart conditions or anything to be on this plan, but it's there to provide some value for you if you do. So $0 test and screenings for a lot of the relevant tests. A lot of $0 drugs in that realm as well, both generic and brand name. $0 durable medical equipment, and again, there is that rider available for the adult routine vision. Okay, the high deductible health plan preventative silver. And again, this is, you don't have to be diagnosed with anything special to be on this plan. Anyone can enroll in this plan, but it's designed to reduce expenses on preventative care for those diagnosed with chronic conditions such as diabetes, congestive heart failure, and coronary artery disease. So this plan is HSA eligible. We use HSA Bank as our provider there, and there's no fee to the member. But $0 test and screenings, $0 preventative drugs, ACE inhibitors, beta blockers, and statins, $0. Anti-diabetic, generics and brand names and the insulins there. And then $0 self-management supplies on prescription drug lists. So these three plans, and again, I said these plans get their own slides because they provide a lot of value for people that may need some extra help in this realm. It's not always the best option to have one of these plans that isn't tailored to their needs. Someone that has diabetes, it seems in my mind at the right price, it'd be almost a no-brainer to have them on one of these plans, just for all those zeros related to the DME, the insulins, and things of that nature. If you were on yesterday's webinar with CareSource, they did make a point that there really isn't another carrier that offers these plans that are, these specialty plans that are specific to one of these conditions. So to me, that's a huge step for HAP CareSource, and is going to be a really big value add for us during open enrollment and throughout 2025 here.
So Jack, I have a question on that one.
Sure.
Sorry.
Yep.
So you have the specific diabetes plan, then you have the specific heart plan. And then this one is kind of a mix between the two, right?
A bit, yes, yeah.
Okay.
A
So
bit of
like
a
this
mix
one,
between the two,
this,
and
this, sorry, this one
Sure.
doesn't take care of the CGM, but it takes care of the diabetes supplies and some of the medications. So if somebody was on both
exactly,
sides of the fence, they may want to go with this route.
exactly. Yep, yep. If you know, and it's one of the things we've said for weeks, the weeks that I've been here and the months that HAP has been putting together these plans. Um, you know, these plans do require a little bit extra legwork. Um, and as far as, you know, consulting with these clients and prospective clients as to, hey, what are your true needs here? It's you know, not as simple as, okay, what's the cheapest price for you? Let's get you in that plan. That's really not what we're looking for. So again, yeah, a little extra legwork, and I think you'll see when we get to the commissions page here, we're willing to pay you to do some of that extra legwork. But you're exactly right. This plan can be a little bit of a crossover between the two, get you a little bit of both, and then also HSA eligible. Can be a big value add for some people out there. Okay. Telehealth is available in all these plans. We use Teladoc as our provider for telehealth, but $0 copay. I mean, this has been, I'm sure, one of the fastest growing, you know, benefits over the past couple of years since COVID and things. So it's almost becoming pretty standard in all these plans, but it still requires a slide. So Teladoc is our provider here for telehealth. This is the optional adult vision and fitness benefit. So this is that adult vision rider that was in a couple of those slides, and also an area that I think provides a ton of value. So this is, and I'll just read this here, for around $3 to $4 more per month, and it's a separate plan. You'll see when you do the quoting, once CMS allows it, you'll see, you know, call it the low premium silver, and then there will be another plan that says low premium silver with the adult vision and fitness benefit. But for about $3 to $4 extra a month, adults get access to benefits, vision and fitness, just for, again, that $3 to $4 a month. So looking at the vision benefit, we've partnered with iMed to provide that. So these are annual benefits. So your exams, your standard eye exams, $0 to $65 copay. And then there is a $250, or I'm sorry, $0 to $65 copay or 40% coinsurance, depending on, you know, exactly what exam and you know, the coding and things of that nature. So $0 to $65 copay, and then a $250 allowance for frames and lenses, and then 20% off anything over that $250. So that includes contact lenses as well, one down. And then any laser vision correction, there's a discount there, 15% off. So for $3 to $4 a month for someone to have a $250 allowance for their frames and some coverage for their eye exams, especially with a network like iMed, who's, you know, one of the largest, if not the largest, in the state of Michigan, is a really great benefit, and again provides a lot of value to these beneficiaries. And then the fitness benefit, because it's not just the vision, it's the vision and fitness benefit. This is through Active and Fit. So this gives members gym memberships at no fee, no contracts, no cost. You can see under this first mark here, some of the big names: LA Fitness, Snap Fitness, Anytime Fitness, and even Planet Fitness. So again, $3 to $4 a month for someone to have a gym membership at no fee, it's almost a no-brainer. If someone's ready to go with a HAP plan, it's a pretty easy talk track to get them on the vision and fitness rider here as well. The second point, home fitness kits receive one home fitness kit each year, each benefit year, for a variety of categories like yoga, Pilates, total body workout, and more, with some kits including wearable devices, Fitbits and Garmin's. I have a Garmin for running, and I know I paid well north of, I think, $250 for it. If I could have that for $3 or $4 a month included in my insurance, that would be quite a value add. And then workout videos, healthy living coaching, and all that, and more information can be found on that activeandfit.com. So again, really, really great benefit for members trying to stay healthy. 2025 commission schedule. So these other states are included on here because with that, as long as you're licensed in the other states, that CareSource contract allows you to sell any CareSource product. So that's why those other states are on there, but more often than not, we're going to be focusing on Michigan here. 5% new business and 5% renewal. That extra $1 per member per month comes with that enhanced benefit. That's that adult vision and fitness. But this is the big one down at the bottom here for 2025. Each new Michigan enrollment is eligible for a one-time $100 new member bonus that will be paid out. And that is 90 days. There's a 90-day that policy has to stay on the book for 90 days before that's paid out. So all the January 1st effectives, those will be paid out in April. And that is, just to clarify, that is $100 per head, not per contract. If you have a family of 4 or 5, that's going to be a $400 or $500 bonus on that member, on those members there. So when I mentioned we're willing to pay you to do some of the extra legwork required for these plans, I don't think anybody right now is doing $100 per head. So really great benefit and really good schedule, I believe. Some of these sales operations, this is, I wish that would have said a little bit more, maybe admin, but this is the CareSource support team. That sales support at caresource.com email is a great resource and something that I've used quite a bit, trying to get up to date just in the couple weeks that I've been here at HAP. But CareSource has a great team, and we've obviously been working closely with them. They share a lot of the values that HAP does, as far as service to our agents, service to our members. So it's really been a great partnership. This team is going to help you with the contracting and onboarding, commissions, maybe some general inquiries, and then high-level member information. This is the HAP team, obviously, and we'll support you with plan and product presentations, training opportunities, sales strategies, competitive analysis, general inquiries. So my information is here. I'm going to leave that up for just a minute to make sure everybody, if you've not heard from me yet, to please take down my information. I hope all of you have heard from me by now, whether phone or email. My lines are open to you whenever, any sort of issues, problems you would have, whether, again, phone or email, my lines are open to you in any way that I can help. If you are not yet have not yet gone through the contracting or onboarding, that's in your all case done through your upline here. So you won't have to worry about this email. This would be for someone that was, contracting maybe not through their upline, or something of that nature. If you do have any issues with contracting and onboarding, again, that's something that you can start with me, and then I'd be happy to take over from there if there are any issues that that need assistance. So that's really everything I have for the slideshow. I did, if we had some time, I could go into the HAP CareSource website and give a little bit of a, where do you find the doctors? Where do you find some plan materials? Unless there's some questions that we wanted to touch on for the slideshow.
I do not see any questions so far, so that would be wonderful if you could show us what the website looks like.
Great, great. Let me pull that up and change screens that I'm sharing. Can we see the caresource.com?
Yes, I can see it.
Okay, great. Still in the slideshow. That's okay. So this is about as basic as we can start. If you Google CareSource and you'll see caresource.com right here. This is first of all, a quick step just to find a doctor. This find a doctor tool in the top right here is going to take you and you'll follow a few prompts. I have just been using my home zip code, which is Plymouth, Michigan. So when you get to this point, and you'll have your zip code in, you'll put a street address in if you have the street address for the doctor. You can even use your location currently if you're just going for what's close to the office or what's close to home. You'll go over to the next step where you choose the plan that you're looking for. So we are going to be in Michigan, and we are going to be the marketplace. When you go Michigan Marketplace, it has our HAP HMO commercial network loaded in there. So that's step 2. Step 3 is choosing the type of doctor here. So I'll go primary care physician, and it'll show you a list of names just by location. Now it took a while. It took a second to find. But this search bar that kind of hides up here allows you to filter these names. So I'm going to just this, if we see Howard down here, I'll type in Howard and it'll filter to those names. So there's not exactly you have to narrow things down before you can just put a doctor's name in there. But they're fairly easy filter questions. Just zip code and the plan you're looking for, and then what kind of doctor they are. So that is the Find a Doctor tool. You see there's a little message here that's just saying that availability will start 1/1/25. So come 1/1/25. All of these will not have that little error message there. So there is the Find a Doctor tool. Now I'm going to go back to, again, just the caresource.com. This little drop down, and when I click on Michigan, you'll see this logo up here, this CareSource logo, change a bit to the HAP CareSource. So now you know you're looking at Michigan deals when you see that HAP CareSource logo. There's the marketplace, like I said. HAP CareSource also has some of our Medicaid products, and then the MI Healthy link is the MMP through CareSource. But I'm going to go to marketplace. This is a very easy one, this access plan documents here. If you're looking for summary of benefits, evidence of coverage, whatever it may be, this is a great tool. So when I go down the overview, this will, we'll look at the gold plans first, then we'll look at the silver plans, and then bronze. So I'm going to go into the HAP CareSource silver plans. We can see a 2025 member handbook, an evidence of coverage, and then also an evidence of coverage for the vision and fitness. And then we'll get into the summary of benefits and coverage. So this first list is going to be the standard summary of benefits. Once you see the silver 1, 2, and 3 here, those will be for the cost share reductions. If your member qualifies for those cost share reductions, there are those specific summary of benefits listed here. Okay, let's go back to plan documents. Well, that's really all the plan documents we need to go through. These drop downs up here will really take you to everything you need. If somehow you get somewhere where you can't access the plan documents, you can go over to plans here and the marketplace. Under the marketplace, you'll see plan documents, pharmacy, rewards, benefits and services. For members, this is where they can create their My CareSource login. And that'll be a great tool for them to use. Providers here, this is, you can use the drop down to find a doctor or provider. That is us or you all. Broker tools and resources. Let's click into that so I can go over some of those things. A lot of the basics: get contracted, plans and service, broker service department. There's training. This agent portal is really a white label of Health Sherpa. So we will be on Health Sherpa once the shopping window opens. But the CareSource specific portal is also a version of Health Sherpa, and you should have received some credentials upon onboarding for that agent portal. So if you go in and access the agent portal, I must be having some internet issues because this is moving a little bit slow. Yep, these credentials should be in your inbox if you have completed the onboarding. If not, I have not been sent a list of the credentials, and I'm not sure I will, because that's something CareSource owns. So that email, the sales support at caresource.com is going to be really the most valuable, and that's who you should contact for those credentials. There is a quick training. I did sit through it. It's a couple of years old. If you've used Health Sherpa before, that's not going to teach you anything new. It's just going to kind of go over, Health Sherpa and best practices on Health Sherpa and all the different things you can do there. Search prescriptions can be found here, and then marketing materials is also another great tool. These were just put on the website at the end of last week, I believe. I believe it was Thursday or Friday of last week. So there's a sales presentation that you all will have access to. It looks somewhat similar to what I've gone through, just a little bit more information for the members, but it'll get into the same outline of the bronze, silver, and gold plans, and then it'll get into the specifics on the diabetes, the healthy heart, and the high deductible health plan as well. So that is available to you in this on the HAP CareSource website, also some brochures. Now, I am in the process of getting a lot of these printed off, so I can come out to a lot of the agents in the area and drop off some hard copies. But until then, if you want to just have a couple in the office, you can feel free to get on. Oops, you can feel free to get on and print a couple of those. So these ones are probably going to print a little bit odd because they're supposed to be bifolds. So it would probably be better off printing this one. And this is a good little one-stop shop for all the, if you have little quick questions. Oh, what's the deductible here? This benefit guide is a good one for you. So those are a lot of the major tools on the HAP CareSource website. So I bookmarked that, and you can use a lot of those. That is really all I have. If there's no other questions, again, I look forward to working with all of you this benefit year and beyond. And thank you very much for your time.
We do have a couple of questions.
Great.
One is a few actually. Can we get a list of hospitals that are in the network?
Yes.
That's something
yeah,
you can filter to me and I can disperse to everybody. That would be great.
Sure.
And then also we had a question if the fitness was for all of the plans. Now, I know it's an available supplement, but is it available on all like bronze, silver, gold?
Yes. Every plan will have the option of adding that benefit on.
Okay. And then there's one more. Will there be a new summary chart of the 2025 plans to include these? I'll let you answer too, but what I would just like to remind agents is that he's showing us the portal or, the agent portal page, and there are marketing links, there's sales presentations. Eventually IAD will have some of this stuff built out into our agent portal as well. But I would suggest going into the website and looking at the summary benefits, downloading them onto your computer so you always have those handy, and utilizing the resources. I think I see up top here with marketing materials that you can get. You can use PrintSource to get printed copies sent to you, kind of like we do on the Medicare side. Just order them and have them sent to you, correct, Jack? That's kind of how PrintSource works.
Yes. Well, okay. We might not have that availability yet.
Yeah.
That is the plan to have that up and running.
But, let us know, let me know, or let Jack know if there's something specific in the brochures in the meantime that you would like for him to drop off or send to you. We'll definitely make that happen. I don't see any other questions, but I just wanted to kind of go back to when you said the bronze plans, that you're not necessarily competitive in with those plans. And I think it's important for agents to realize that from CMS's standpoint, if somebody gets a CSR, the first thing we should do is go to a silver plan. That is where they're going to have richer benefits than they would on the bronze, lower out of pocket. CMS is actually going to be looking at agents this coming enrollment year to ensure that if somebody did qualify for a CSR, that we're putting them in a silver and not a bronze. So you'll want to make sure that you share with your clients the reasons why a silver plan would be lower out of pocket. If they still want a bronze, I'm going to suggest that you document that in your notes. Since CMS is pointing that out, that is a touch point for them, you definitely want to be able to come back and say, this is why we chose this plan for that consumer. So, sorry, I didn't mean to go off on a tangent there during it, but I think that's important to know. Like, you may think, well, the bronze plan isn't very competitive, but their silver plan really is. So definitely keep that in mind when you're looking at plans. All right.
Sure. Thank you for adding that. Yes, thank you.
And then one final question, are these available off marketplace?
So these plans, as we went over them, are only available on the marketplace. HAP still has their own plans that are off the marketplace. Those are done directly through HAP, and honestly, not something I've really touched yet.
The current HAP plans will still be available through the HAP site.
Correct, correct. But these plans, as we went over them today, are only on marketplace.
Fantastic. Well, we're super excited, and it's great to have a new product coming into the market. It's never a bad thing. And again, if you have not completed your contracting or have not been sent contracting, please let me know. We want to make sure that we get everybody up and running. We are 9 days away from open enrollment, so we definitely want to make sure everybody gets their contracting done. If you have it sitting there to complete, just a reminder, do not check the Medicare box. The contracting link comes directly from CareSource. It doesn't mention HAP, it doesn't mention IAD, but there's a Medicare and a Marketplace that you can check. Please be sure to just check Marketplace, and that way your contract will not get hung up and you won't be delayed while we're trying to figure out what happened with it. So again, if you don't have a link and you need one, let me know. If you have a link and haven't completed it, please do so as soon as possible so that we can get everybody set up and ready to run on 11/1. And thanks again, Jack, for the great presentation. We appreciate your time.
Thank you so much. I appreciate being here. Have a great week.
Thank you. You as well. Take care, everybody.